This meeting is being recorded.
All right, let's get started. Okay, so hi everyone, and welcome to today's webinar on diabetes. So today joining us will be Dr. Courtney Mapes to educate us and inform us about diabetes. But before we get started, I would like to say that this meeting is being recorded, and if more people happen to join us, the questions and answer part will not be recorded, but I do have a list of questions just in case. So without further ado, Dr. Mapes, the floor is yours.
All right. Hi there, I'm Dr. Mapes. I'm a family medicine physician with Heartland Health Centers and work at our Devon and our Lakeview locations. So just was gonna go over a little bit regarding diabetes, and then I think we have some questions specifically regarding like diabetes and COVID and the COVID vaccine at the end. So thought I'd just start out with what diabetes is, right? Start at the beginning here. So you want to go ahead and give the next slide. So diabetes, I think it's important to remember that it's a chronic medical condition. So it's long lasting. It's something that when somebody's diagnosed with, they're going to have for the rest of their life. And it affects how our body turns food into energy. So everything that we eat basically is broken down into sugars or to glucose. And that's released into our bloodstream. So we eat it, it breaks down into those sugars and goes into our bloodstream. Now, normally what happens is that when that blood sugar is in our bloodstream, it tells our pancreas to release insulin. And that insulin acts as a key that opens up the cells and lets the glucose go into the cells or lets the sugar go into the cells. And then we can use it for energy for our daily activities. So the normal process is that key insulin is going to open the cells and let the glucose go in. When we have diabetes, there's something about that key that's not working. And we're not getting the glucose to go into our cells. We're not getting the sugar to go into our cells where we can use it for energy. We can go to the next slide. So if you have diabetes, it's either that one, our body isn't making enough insulin, or we are making insulin, but it's not using it as it should. It's not utilizing the insulin that we're making as it should. And so in that case, that key is not working. We're not moving the blood sugar out of our bloodstream. It's staying there. It's not getting into the cells where it needs to go. And over time, if we have a lot of sugar in our bloodstream, it can cause problems. And it can cause problems really anywhere in our body. You think about that blood, it's going to travel all over our body. So we worry about problems with like our eyes and our hearing, our heart, our kidneys. All the organs can be affected by diabetes really because we have this blood sugar that's just roaming around and can't get to where it goes. Go on, we can go to the next slide. So there are a few different types of diabetes that I just wanted to hit on because I think it's important to understand the difference between the types. So we have type 1 and type 2, which are probably the most common that people have heard of. And then we have gestational diabetes. So we'll go through each of these separately. So let's go to the next slide. So type 1 diabetes is actually an autoimmune reaction. So your body has actually attacked itself by mistake. So for some reason, your body has made this attack against itself and your body stops making insulin. Now you have to have insulin to live. And so for those patients, they have to take insulin. They have to be on insulin injections or have a pump or some external form of insulin. It's actually the less common form of diabetes. So only about 5 to 10% of diabetics are type 1. And a lot of times we see it more often in kids. So many times children or young teens, adults will come into the hospital or the emergency room because of symptoms that they're having, and they'll be diagnosed with type 1 diabetes. And again, in those individuals, they have to have insulin to survive. There's really nothing that we can do to prevent it. We're still learning about type 1 diabetes and why it occurs. So it's nothing that somebody did in their lifestyle or what they were eating or their activities that made them have type 1 diabetes. It's just something that sometimes happens. It's that autoimmune process that the body is attacking itself. All right, so we can go to next slide. So type 2 is probably the most common type of diabetes. And if you run into somebody with diabetes, it's more likely the type of diabetes that they have. So in type 2 diabetes, it's 90 to 95% of our patients with diabetes have type 2 diabetes. It's going to happen more often as we're an adult. Although as in America, we're seeing it diagnosed younger and younger. So nowadays we are seeing it sometimes in teenagers or young adults as well. But more often it's in our adult population and more often associated with our lifestyle to some degree. It can also be some genetic factors involved as well. So for these individuals, their body still makes insulin, it still has insulin, so they don't have to be on insulin. But their body's not using it as well. For whatever reason, their body's not utilizing the insulin it makes. And so sometimes they're on oral medications, so things like metformin or other oral medications. Sometimes they are on insulin too, but they don't have to be. And many times it develops over years. So you might see your doctor and they might say, hey, it looks like you're headed towards diabetes, or maybe you have something called pre-diabetes, right? That we're headed towards this problem. And so slowly over the years, the sugar's going up and changing. And then eventually we get diagnosed with diabetes. Sometimes you might just show up to your doctor and they say, oh, you have diabetes. Maybe you weren't checked for several years, or maybe it is something that happened. But it's more of a slow process. It didn't happen overnight. And it is, again, it's related to our lifestyle. So for type 2 diabetes, since we're still making that insulin, the things that we can do to help change how our body uses insulin is losing weight sometimes can be helpful, depending on your situation. Eating a healthy diet is good for everybody, particularly good for our type 2 diabetics, and being active, again, something that we can all benefit from. So definitely eating a healthy diet and being active play a big role for type 2 diabetics. And then we'll go to the next slide. And then the final is gestational diabetes. This happens during pregnancy. And basically we have a lot of hormonal changes going on during pregnancy, and the body's just not making enough insulin, or again, not using that insulin that it's making as well. It affects about 2 to 10% of US pregnancies. It doesn't mean that you will have diabetes in the future, although we do tend to rescreen and check after you're pregnant, check later in life, because it could signal that maybe something's going on, but maybe you just have gestational diabetes, you never have diabetes again, or it could be a sign that maybe there's something hidden there that we need to keep an eye on. A lot of people don't even have symptoms, but it is something that's routinely tested for during pregnancy. So if you're pregnant, your doctor's probably going to be checking for gestational diabetes at some point during your pregnancy, just to keep an eye on that, because there are some complications with pregnancy that can occur. And again, you see there again, healthy food or healthy diet, physical activity are key for managing this type of diabetes as well. Sometimes people are also placed on medication, even insulin, while they're pregnant, depending on what their blood sugar numbers are and things like that. So we have type 1, type 2, and gestational diabetes. They're all common, they all occur. Majority of us probably have type 2 if we're looking at kind of our general population. All treated, to some degree the same way with diet and exercise. But that insulin factor for type 1, they have to be on insulin, whereas the others, they might or might not. We can go to the next slide. So the next thing we were going to just talk briefly about was how we monitor blood sugar, right? We talked, the sugar is the thing that we're worried about with diabetes. We got that blood sugar running around in our blood, and we want to know the numbers. We want to know where we're at. So we'll go to the next slide. So we have a couple different ways we can monitor that. One's called an A1C. That's a way we monitor the blood sugar basically about every 3 months. You can come to your doctor or go to the laboratory, have a blood test done. that give us an average of what your blood sugar has been over the last 3 months. So that's a good way to kind of just keep an average monitor of how the blood sugar is doing. And you also have like a glucometer or a glucose meter that maybe you have at home where you can check your blood sugar and see what your blood sugar is at right at that very moment. Some people use that to track their sugar throughout the day or from day to day, what their sugars are doing. So a couple different ways that we commonly monitor blood sugar. There's one more, if you want to go to the next slide. There are a few patients that have continuous glucose monitors. So a lot of times these are used for particularly like our patients that are on insulin, so our type 1 diabetics where maybe their sugar is really variable. Or if you just have really hard to control diabetes, the continuous glucometer can be really helpful. So this is monitoring our sugar constantly. It's just keeping an eye on those blood sugar readings all the time. And now with our smartphone and apps and things like that, it's really easy to get readings for those, which is really nice and saves from sticking fingers and getting blood draws, which can be really helpful for those people that need to check their sugar a lot of times. We'll go on. So just kind of some general goals that we're thinking about for blood sugar. And I always caveat this is that you should definitely talk to your own provider and discuss what your goals are, because it's going to vary depending on a lot of different factors, how long you've had diabetes, where you're starting from. So these might not be your particular goals. These are just kind of general references that sometimes we look at. So if you have particular questions, I definitely would say talk to your doctor, but this might give you a frame or a reference to start with. So just checking our blood sugar with like our glucometer or blood glucose meter, usually before a meal. So first thing when we wake up in the morning type thing, our sugar should be about 80 to 130. And then if it's 2 hours after a meal, we want to see it less than 180. And again, that's just a rough estimate. It's going to depend, again, our activity, what we've been eating and things like that. But those are roughly normal numbers that we'd like to see our sugars under. For our A1C, kind of the gold standard is 7. And again, if you have some other complications or things, you might want to talk to your doctor if that's your goal. But 7 is kind of a general number that we like to try to keep that A1C under. So if you're going in and getting your blood checked with your doctor, those are just some reference points to kind of keep in mind. All right, next slide. And then just a few monitoring tips, and then I think we'll get into the questions. With checking our sugar, we definitely want to check it either before we've eaten or wait 2 hours after we eat. We know our sugar is going to go up when we eat. That's normal. But we can get a fasting sugar can help us kind of see where our average is going. I usually tell people to contact their doctor if their sugar is going under 70. It might be a sign that your blood sugar is dropping too low. At least have that conversation with your doctor. And certainly if you're not feeling well, that's always a good time to check your sugar. So if you're feeling sick or you don't feel right, check your sugar, see what it's at. If you have a glucometer at home, obviously that's easy to do. If you don't, it might be a conversation to have with your provider. And then write those numbers down. If you are taking the time to check your blood sugar, write it down, make a report of some sort so that you have that information to give to your provider. It really does help us, help you control your blood sugar and help make decisions of like medications or changes in our diet, things like that. So the more that if you are checking, we want to take advantage of those checks that you're doing and have that information. So write it down, bring it into your appointments, and we can use that to make decisions about how to manage diabetes with you. And then always with travel, COVID's getting better, but actually the rates aren't so good right now. But I think people are kind of over COVID. We've started traveling a lot more. It's summer, people are getting out and moving around. If you're traveling, just make sure you carry all your supplies with you, right? You don't want to be in the airport and not have your supplies with you. So, or even on a long car drive, make sure you have your stuff with you. So if you're traveling, make sure you bring all your diabetes equipment with you so that you have what you need wherever you're at. All right. So getting into COVID, so I just put together a few common questions, and then we'll take your questions, of course, too. We've had obviously COVID for 2.5 years now, and we're still learning about it actually. And we have some good data, but we're still understanding more and more. So I think one of the most common questions are people with diabetes more likely to get COVID? Are they the people that get COVID? So we can go to the next slide. So actually, even 2.5 years in, they're still saying there might not be enough data to really say, if you have diabetes, are you more likely than the general public to get COVID? Anybody is really susceptible to COVID, right? We've seen that with kids getting COVID, adults getting COVID, anybody can get COVID. Now, let's go to the next question, because this might get more to the heart of what people are asking. Do people with diabetes have a higher chance of serious complications from COVID? Right, so we've said, hey, we're all at risk for COVID, but what about those people that get really sick from COVID? Let's go to the next slide. And this is where we see that diabetes can be a problem. So in general, people with diabetes are more likely to get severe symptoms from any virus, from any illness that they get. They are just at higher risk for complications. And we kind of hinted that back at the very beginning when I said you got all that blood sugar running around in your body that your body can't deal with enough, and it causes problems with lots of our different organs. One of the things that interferes with is our ability to fight infections. So any virus, any illness that somebody with diabetes gets, they're going to have more complications than the average person does. And so unfortunately, that does mean that there is a higher risk of complications for somebody with diabetes that gets COVID. If your diabetes is well managed, so if your sugars are well controlled and you're doing really well at keeping your sugars down, your A1C is under 7, you're less likely to have those complications, but it's still a risk. What we also see is that people have other medical problems sometimes when they have diabetes. So we have diabetes, maybe we have heart disease, maybe we have high cholesterol, maybe we have problems with our kidneys, we could have other issues. And when we have those other issues, that also makes it harder for our body to fight an infection. So even though we're all kind of at risk for COVID equally, just having diabetes itself doesn't make you at risk for COVID. The problems that come with COVID are going to be greater for those with diabetes, or could be greater for those with diabetes. Next slide. So are there different risks for people with type 1 and type 2 diabetes? It didn't really include gestational diabetes. Pregnancy has its own risk factors as well. But for type 2 and type 1 diabetes, is there going to be a difference for those particular people? We can go to the next slide. And really right now, they're saying no, that they haven't seen a significant difference, right? It's that diabetes overall and our control of diabetes. So whether you have type 1 diabetes, type 2 diabetes, it really is more about how you're controlling your sugars, and that's going to be putting us at risk for complications from COVID-19. It is, like I mentioned, it's still a new disease. We're still learning about it. So, hey, maybe out there in the future, we might have some additional information that gives us answers to some of these questions. But for now, we would just say it's that risk of our high sugar that's putting us at overall risk. Next slide. And then, does COVID-19 cause diabetes? So this actually wasn't a question that was really on my radar, but it is something I found on the internet that I saw pop up a couple times. And so I thought it was important that we just bring it up and address it, right? So I didn't realize it, but people are worried that COVID-19 can cause diabetes. And in fact, the CDC says that there are some studies that suggest that once people have diabetes, they have been more often diagnosed with, once a person has had COVID-19, they've more often been diagnosed with diabetes following that. Now, the question is always, did the COVID-19 cause the diabetes? So how are they related, right? So did we have diabetes and not know it and got COVID-19, or did the COVID-19 caused the diabetes. I think there's still a lot of debate in that area. I don't think we probably have enough studies to say that. But again, we know people that have diabetes are at higher risk of getting sick. And so if you have something like pre-diabetes or you already have a risk factor, that may lead you to have complications from diabetes or complications from COVID. So it's hard to say that COVID-19 is causing diabetes, but we do see this relationship in that those people that are really sick with COVID-19, we have seen a higher rate of them diagnosed with diabetes after their infection. We also have type 1 diabetes that we're not really sure what causes it. It's this autoimmune reaction, and sometimes that can be triggered by a viral infection. This autoimmune reaction can be triggered by a viral infection. So in that case, there might be some sort of relationship if your body's been attacked by this virus and it triggers this autoimmune reaction that you could develop diabetes following a COVID-19 infection. Again, I think there still needs to be some studies on this, but it is something just to kind of consider and be aware of. And I think more reflecting back on like our risk factors for diabetes and for getting really sick from a viral infection in general. I think that might be my last question that I brought. Yep. So obviously very quick overview of a lot of information. But if people have questions or concerns, I'll turn it back over to our host because I just dumped a whole lot out there. But we'd be happy to answer questions and concerns.
Yeah, thank you, Dr. Mapes. That was amazing. That was a lot of information, a lot of useful information. And I think those COVID questions were some of the questions that I actually had on my list because they were common questions that people had. But I do have a few other questions, but I would like to open the floor to the audience. Does anybody have any questions for Dr. Mapes?
And I think, yeah, go ahead.
Can you tell us about the numbers? How do you know about the numbers?
About numbers for like blood sugar, for COVID?
No, for blood sugar.
For blood sugar? And for like checking your blood sugar?
Mm-hmm.
And so when do you check your sugar, or what particular are you interested in about the numbers?
Oh, because the doctor told me I'm pre-diabetes.
Mm-hmm. So
Question.
This meeting is being recorded.
If, let's say, a woman is pregnant and she has gestational diabetes and she doesn't take care of it throughout her pregnancy, and she goes into labor, but during labor, even then, it's not taken care of, does that end up affecting the baby somehow?
So definitely, and that's why obstetricians screen for gestational diabetes, right? So a lot of people might, again, they feel fine, they don't notice they have any problems, but really their sugar is a little bit high. And so we screen all pregnant women for gestational diabetes just to make sure we don't miss it. The real complications, there's several complications. One of the big ones is that the baby can get too big. And so if the baby grows too much, that has risks even with delivery, right? So if a baby's too big, you might have to have a C-section, or sometimes babies can almost get stuck. Now, thankfully, we can do things like C-sections, but they can get too big. And then once the baby's born, the baby can have a little bit of problems controlling its blood sugar because it's been getting all the sugar from mom, and now it has to figure out how to control. It doesn't mean the baby has diabetes, and long-term, the baby shouldn't have any problems with its sugar, but it can have trouble those first few days, or just even the first few hours trying to control its sugar. So sometimes it has to have kind of special care. If people's sugars are just really crazy, it can cause problems with like the growth and development of the baby too. That's a little more rare, but just having a big baby or a baby that has trouble controlling its sugar is actually fairly common. And that's why if you have gestational diabetes, it's so important to talk with your provider, talk about diet, exercise, maybe even medications.
Thank you.
Yeah.
My next question is, would you recommend a second booster for individuals with either type 1 diabetes or type 2 diabetes?
So that great question. I should have put that on the slides because that is so key. So right, we've had COVID-19 now for 2.5 years. We had the vaccine that came out. A lot of people went out and got their first vaccines because we were like, yes, we're ready for this. We were all ready to get back. So hopefully people have gotten their first 2 vaccines. Hopefully they got those like last year. So those 2 right off the bat, everybody should have got. And then we started offering that first booster. Now, if you have any condition that lowers your immune system, or any chronic medical problem, we'd recommend that second booster. So if you have type 1 diabetes, type 2 diabetes, you definitely would qualify for a second booster, and we definitely would recommend that. Again, we know if you have diabetes, you're at higher risk for complications for COVID. We've seen a lot more COVID recently. It's out there in the community, it's everywhere. And so getting that second booster can give you that extra protection that your body needs that maybe you wouldn't be able to fight off a serious infection. So yeah, get your second booster for sure.
Great, thank you. And then my last question, I don't know if it might be a little bit too far out, but it is, as a diabetic, should I be concerned about diabetic ketoacidosis? I know it was one of the questions that people were asking.
It came up. Yeah. So diabetic ketoacidosis is usually comes from our blood sugar being uncontrolled. So if our sugar is really high, we can get something called ketoacidosis. So I don't necessarily think I would be, worried about it, but if you're not controlling your sugar, it's something that can happen, right? And it ends up putting people usually into the emergency room, into the hospital. You can even die if your sugar is so out of control. It can lead to death. So it is definitely a really serious complication. For most diabetics, if we're talking with our provider, if we're controlling our sugar, it's not something we need to be, concerned about or thinking about on a daily basis. But if you have really high sugar, really uncontrolled sugars, it is a potential life-threatening complication. And so good just to know a little bit about it. So have that conversation with your doctor, talk to them about it. Again, controlling our sugar is the very first thing that we're going to focus on. And if you're doing that, you're going to prevent something like ketoacidosis.
Great, thank you. Does anybody have any other questions for Dr. Mapes?
I'll jump back in and then we'll get to your last question. You mentioned like the COVID booster. The other thing I would say is get your flu shot when it comes out this fall, right? So keep your ears open because those will be coming out this fall. We're early in the summer right now, but just like we recommend the booster for the COVID vaccine, we'd say get your flu shot as well. So just to piggyback on that message. Go ahead with your question.
Okay, if the person always is looking for something with sugar, is that signal maybe has diabetes?
It really isn't. It's not something that we see. I hear that a lot from patients, and I hear a lot of people worried about that, right? Like, oh, I'm always want sugar. I'm always seeking out sugar. Maybe I have diabetes. And it's not necessarily a sign of diabetes. Now, again, it might be a sign of other things though. So I think it's worth, if that's something you're really noticing a lot of, it's probably worth having a conversation with your provider. And there may be some testing that they recommend. But just that craving for sugar, maybe it's just human nature. But I don't think it necessarily means you have diabetes, but it might be worth a conversation with a provider just to figure out, is there something else going on? Is there something that we need to be worried about?
Yeah, because I have my other daughter, always she's looking for the cereal. When she finished to eat food, She's looking for the cereal in the morning, cereal in the afternoon, cereal in the night. You say, I'm worried, but you say it's better to check with the doctor, right?
Check with your doctor, right? So some things are just habits that we've gotten into, right? If we like to eat cereal and we've gotten the habit to eat cereal actually doesn't really fill us up that great, depending on what kind of cereal you're eating. A lot of times it is kind of sugary. And so you
sugar.
Yeah, so you metabolize that quickly, so it leaves you wanting more, right? So it may be that she's just not eating the things that are really filling her, and so she always feels hungry. But it doesn't necessarily mean that she has diabetes. On the other hand, if she's not eating a great diet and not exercising and has a family history of diabetes, it might put her at risk for diabetes down the road. So, yeah, I think it definitely is worth, kind of keeping an eye on it and maybe having that conversation with the doctor. But it doesn't necessarily make me think, oh, she has diabetes. We'd have to look at the whole picture.
Okay, and what about the symptoms? Because when you start to shaking or start to be anxiety, shaking, or when you have angry, when you want to, your stomach ask for food and you don't have anything close, but you start to shaking, is another symptom? Or...
Another symptom. So certainly if somebody has well, particularly if they have diabetes, but really anybody, if your blood sugar is very, very low, you could have things like shaking, or people can even like pass out or lose consciousness. So there are signs that our blood sugar is really low or signs that our blood sugar is really high, that our body can have both of those types of symptoms. It's hard though, because again, like you could be dehydrated and you can feel like lightheaded or dizzy or shaky, right? Or some people, if they get really stressed, they feel lightheaded and dizzy and shaky. So I think in those cases, again, I would probably make an appointment and have it evaluated. There's a lot of little symptoms that people can have that might suggest diabetes, but it's not absolute. And that's where you need to have a conversation and probably do a blood test.
Okay.
Yeah, it's probably the simplest thing to say, and just get it checked out.
Okay, I guess because many people ask for something and it's good to know.
Yeah, and sometimes it is diabetes, and sometimes, like I say, it could be something totally different, right? It could not be related to diabetes at all, or it could be a sign that, hey, there is a problem and we need to address this. So whatever's going on, if it's not normal for you, right? If that's not how your body usually acts, or that's not, you don't feel well with how you're doing, as they go in and have that conversation. Because whether it's diabetes or something else, something different's going on. And so it's worth having that conversation. And many times your provider will do some blood work and try to figure that out. And if it's diabetes, address it that way, or whatever other problem they might encounter.
In case, if we are in the street and we find somebody has diabetes, and he don't has a medication, what we can do for help the person until she went to the doctor or the ambulance or something, what we can do? Nothing?
Yeah, that's a great question. So if you just come across somebody and they have diabetes, but they're having an issue. So I think first, like you say, call 911, right?
Yeah, first, always.
You're not the expert, you need help. So call 911 and get some help on the way. So number one, call 911. Number two, if they have a glucometer, if they have a glucose machine, they can maybe check their sugar, and you can maybe help them do that if they're not feeling very well coordinated, but they can check their sugar oftentimes. And that would tell you, because it is going to depend. If their sugar is really high, ultimately they need to get to the hospital. Now they could drink like some water, if they're conscious and they're talking to you, they could have some water to drink. But if their sugar is really high, they just need to go to the hospital because they're going to need some medication for that.
Okay, but the first we can do is water.
Water, if your sugar's high. More commonly, what you might run into is somebody whose sugar's low, right? So maybe a diabetic gave themselves too much insulin, or maybe they're sick, or maybe they missed a meal, something like that. And so maybe their sugar dropped really low and they weren't anticipating that. So again, we'd always say check their blood sugar first if you can. So if they have their machine, they could check their sugar and see what it's at. But if their blood sugar's low, then usually giving them, again, if they can talk to you and if they're coherent, they could drink either like a little bit of juice or have something sweet to eat to get their sugar back up. First, call 911.
Yeah.
Only if they're like talking and conversing with you, then they could drink a little something sweet would help.
And also, we can help you.
Yeah, ask if you can help. Yeah, and most people that have diabetes, they're gonna know their symptoms, so they'll know how they feel, and they can probably tell you what's helpful, right? So they might say, call 911 for me. You can do that, or hey, I really need a glass of orange juice, and maybe you're near a store and you can grab that for them. So. Yeah, ask the person what's most helpful, because they're going to know their own system, their own symptoms, their own body the best. But yeah, great question. Ask them how.
Thank you.
Yeah.
All righty. Thank you everyone for joining us today. And thank you so much, Dr. Mapes. That was very helpful. Thank you so much for answering all of our questions. Sorry. Thank you so much. And hopefully everyone can join us next week, July 21st, for our webinar on blood pressure. It's going to be at 6 p.m. and it's going to be the same meeting ID that we used for this one. So again, thank you everyone. And thank you so much, Dr. Mapes.
Yeah, nice to meet you. Great questions. Good to see everybody.
Thank you. Good night.
Have a good evening.
Have a good night.
Bye-bye.
Bye.